Good evening and welcome to tonight's exciting event titled Continence Care in COVID and Beyond. I am Alison Schofield and Clinical Manager at Mole Digital, and this event is hosted by Urology and Continence Care Today and kindly sponsored by Essity. We are all live at home, as you can see, so please bear with us if we do have any technical difficulties throughout the next hour. Certificates will be available for your continuing professional development, always important, at the end of the session with an online link. So please do stay with us to the end. And so important, in the comments section, do ask questions throughout, and we will get to as many questions as we can at the end. If we don't get to everybody's questions, we will get back to you within the next couple of days. So we've got an expert panel of speakers this evening, and we will be exploring the increased demand on continence care service, and particularly during the COVID-19 pandemic, where many services have had to change in delivery. And those of you in the audience tonight, some of you will be from continence services, and some of you will be from other types of healthcare and social services too. So we're going to explore the exceptional care that was delivered and address the challenges faced in the current climate. We have a unique approach by Essity's Care at Home team, which created a network of clinicians and an outlet for them to hear each other's challenges and to provide support. So we will be exploring that. Through one single discussion, a forum was born in the north of England, which gave opportunity for bladder and bowel healthcare professionals to interact and provide a support network. And during the COVID pandemic, we've seen so many specialist services, and I know that as a tissue viability nurse, to the change in care delivery due to staff redeployment to other areas like the acute wards and the rise of virtual patient care. And this isn't any different in the continence care service sector too. Some of this, of course, has been positive, as we know, but also that can create an isolation of staff and an increase in patient issues and referrals. So we've got an amazing panel this evening of representatives from some areas of the bladder and bowel multidisciplinary team, and we're going to explore how those services were affected during COVID and what the positives that came from this too, including how the forum can be expanded across the UK to strengthen those networks and ensure patient quality shared care. So don't let me badger you any longer, and let me introduce you to our amazing panel. So we've got Karen Irwin, Service Manager and Specialist Nurse of the Bladder and Bowel UK team and Disabled Living. Hi, Karen.
Hi, lovely to be here tonight. Thanks for inviting me along.
Lovely. And we've got Tracy Evans, who is Continence Clinical Nurse Specialist at Horncastle Memorial Hospital. Hi, Tracy.
Hi, thank you for having me.
We've got Louise Smith, Clinical Team Lead in Community Bladder and Bowel Services in Central Cheshire Integrated Care Partnership NHS. Hi, Claire.
Hi, okay, thanks for inviting me.
And we've got Alison Wileman, who is Registered Nurse and Strategic Healthcare Partner of Continence Care with Essity and Continence with RCN Bladder and Bowel Forum. She's the chair of that with the RCN. Hi, Ali.
Good evening. Thank you for letting me join you.
And last but no means least, we've got Sarah Murray, who is Clinical Consultant with Essity. Hi, Sarah.
Hiya, nice to see everybody.
So let's waste no time, and we need to get on to this discussion because we've been chatting away and there is so much to talk about, and we want you to get engaged as well. So please post all your comments and questions. So Claire, I'm coming to you first. And I know you're so enthusiastic about this, you're bursting with what you need to tell us. So in what way has COVID-19 changed your particular role within, continence care? And did redeployment impact on your team specifically, or did you know of teams that it did?
So we were very lucky. We weren't redeployed within our division and our trust. So the redeployment didn't really affect us as a team. However, I think none of us really expected to ever work through a pandemic. And I think what happened was we had to look at different ways of working immediately to try and to see our patients to make sure that they were safe and that they were getting all the care that they deserved, really. So we looked at all different ways of working and looked at ways of trying to reach out to sort of nursing homes, residential homes, without going in and putting those patients at risk, because a lot of residential homes and nursing homes, we all know, close their doors to protect their amazing patients. So we really quite quickly, actually, and when we think about it now, we just sort of focused on what we needed to do, and we looked at a lot of telephone assessments. We had our video assessments as well, and we were a bit worried about that, because we know that sometimes some of our elderly population isn't very IT savvy. But do you know what, how amazing were they took it on board. They were on, using their mobiles, and a lot of their families bought them mobile phones through the pandemic, so they could FaceTime each other, families. So they were really on board with that sort of assessment, and we just sort of remained really positive and tried our best, and we still saw our patients, especially ones that were very clinically vulnerable, and we still went out to see them. But a lot of our assessments were via telephone and video link, and I have to say, a lot of our patients have really progressed still using that system, and I find that some patients actually open up more over the telephone than face to face, because we talk a lot about stigma and embarrassment that's related to bladder and bowel dysfunction, and our patients seem to open up more when they're not face to face with us, and will tell us more information over the telephone. So that's what we did. That's how we changed our service, and I think that all the ladies that are on the call now, they did the same sort of thing. And we continue to do our very best to keep our patients, safe as possible.
Yeah, absolutely. And there's some absolutely great stuff that because we had to adapt so much, didn't we, in the NHS with COVID and everything that happened in so many different services. Were there any negative impacts from that, though? Increased referrals, and you must have seen some negatives as well.
Yeah, I mean, I think the first wave, we never really had any dips in referrals coming in. They continued to come in. However, now we're seeing a massive amount increase in referrals for our adults service, and I think that's the aftermath of the 2 lockdowns, where a lot of we look after in my area a lot of patients over the age of 70, so our main sort of patient population is elderly, and we are seeing such a lot of referrals now, and probably due to the fact that our patients have got worse with the continence, because they were socially isolated. They get deconditioned really quickly. Their mobility is affected, so therefore if their mobility is affected, their continence is affected, and so we are seeing a massive increase in referrals at the moment. Yes.
Yeah, thanks, Claire. That's it's so interesting, isn't it? The positive and the negative. And I want to ask Tracy, because you've been out there in clinical practice as well, and that Claire mentioned those positive impacts in patient care, and I want to pick up on that, because there's so much talk about digital, virtual consultations, digitalisation of the NHS. We know it's been happening in GP practices. In your services, do we see this as an ongoing thing? Can we make it better?
Yeah, I think it's something we're definitely going to be doing more of moving forward. It was something we were considering with some of our patients pre the pandemic, and we were looking at training through different sorts of mediums, and I'd been lucky enough to go on the ECHO project with the hospice, which had a form of teaching similar to Microsoft Teams and like we're doing across Zoom, which we were told at the time, May 2019, we're probably not going to see this anytime soon. And then fast forward on through COVID, and we're doing it. We've been able to do teaching with the care homes. Different to Claire's patients, we found that our patients have been happy with telephone consultations, but they've not felt comfortable with the bridge with the video consultations.
And it's very individualized as well, isn't it, for the and that's important, isn't it, for the particular patients. That echo project, I did that as well. We did that. I did that in the trust I was in, and we did that with pressure ulcer education as well. And so that and that, like say, we picked up that virtual where we couldn't go into the care homes, but you and I both delivered the education in that way. And so there are some fantastic supports out there, you know, that people can get involved with. Aaron, can I ask you about you know, COVID-19, how it's exacerbated the impact of people, of carers managing incontinence? I know, you know, you have been involved with, you know, obviously with the Bladder and Bowel UK helpline that you're involved with, and you know, you were mentioning that you'd seen an increase in calls to the helpline, and you know, isolated and having to buy their own pads and support. What can you just explain to us?
I mean, I think we found that COVID's really impacted people in so many different ways, and I think as a third sector organisation, and this isn't just us, this is the other charities as well, often we can be that first point of contact really for people, even before they maybe get to the GP, or even if they have that initial chat with the GP, they then may well come, you know, back to us. And so, you know, they may come to us, and I think fairly swiftly last year, we saw a real significant increase in calls, and we've sort of done a bit of a, you know, sort of check on the number of calls, and from January to July this year we've received 3,000 enquiries through to our helpline already. You know, and we're aware that maybe that is as a result of maybe the redeployments and the services, etc., not being there, and people have managed to find us, whether it be online, through word of mouth and what have you. And I think there's a variety of reasons that, you know, people will contact us, and I think in some instances those reasons have not changed from pre-COVID. However, some elements have changed. So we're finding that where people may be caring for a relative, and that relative may not necessarily be ill, it might be that they've not been able to go out and they've been self-isolating, but the relative is finding that they're popping a packet of pads into a shopping basket in the week, and then they might contact us to say, how do I broach having a conversation about this with my relative? Or I've had the conversation, and how do we, you know, seek help, and how can we, you know, get some treatment sorted? And I think the other thing that we found is as well is that people are sort of contacting us with what appear to be red flag symptoms as well. And again, I think it's really important that we urge people to can be, you know, devised. And I think for us as well, with the long-term, you know, the NHS long-term plans, where we're talking about patient empowerment, patient self-management, I think the charities can sometimes act as that wee bit of a stopgap, providing that initial maybe advice, practical solutions. And, you know, we have lots of useful information and resources on the websites, as do all the charities, but I think we're also mindful as well that we're not that individual's clinician, and it's so important that we get them to sort of seek help and further assessment. And I think it's also maybe sometimes we're often in that listening ear, because like you alluded to about the isolation, where people may go up, they're not going out, and they might have been managing a bladder or bowel problem, but that's become more magnified because maybe they're not seeing people, they might not be seeing the nurses as they were seeing, so they're then, you know, sort of contacting us. But I think it's also an opportunity for maybe new people coming through, for us to inform them about services and about the services that are available. So, for example, about having a bladder and bowel assessment, and informing people that treatments are available, and that, you know, one of the things that we might calls to get to the charity is, how do I get free pads? And I think it's trying to say, look, we need to get a continence assessment, and then we can, you know, take things from there. And I think it's just getting people on that right path, which is essential. And I know Claire's talked about that increase in referrals, and you can imagine if people are coming to us and we're then referring back out to the services kind of thing. But I think, again, you know, it's been alluded to, I think it's not just the bladder and bowel services, but it might be other services like OT, physiotherapy, and the secondary and tertiary care services. And it might be that when people are on that journey, they don't need all those services. But again, it's empowering them with that knowledge that there's a lot of people out there that can help with bladder and bowel problems. So I think the third sector does have that equally important role to support people with bladder and bowel difficulties. And it sort of complements, you know, the work that's going on as well within the NHS, you know.
And it you know, it's so because a lot of us are not aware of like the work that your charity does, and you know, and so if we're not aware, then patients are not aware. So it's and especially obviously during the past, you know, 18 months, it's so vital that people have somewhere, have a helpline to go to. And like you were saying, obviously, like with the red flags, you know, it is so important, isn't it, that you know, you know, we know we've all had difficulty accessing GP practices and healthcare professionals, but you know, the appointments are still there, and people need to not be sitting on the red flags, and they
absolutely and I think it's sort of reassuring people that they're not making a fuss. This is important, and that, as you say, the services are there and people do need to be seen. And sometimes I think, you know, people just want that reassurance that I'm not making a fuss making this call, and it's almost, you know, yes, I will make that call to the GP. So it's confirmed really what they know really, but we're just, you know, sort of trying to encourage them to make that call really.
And it all works together. It's that MDT, like you're saying, that kind of that third sector, you know, how important that is. And do you know, tonight I was listening to the ITV news tonight just before we came on, and there was a sector, an item, and it was about care homes and domiciliary care. And they were talking about, obviously, the crisis. There's a massive crisis, as we know, in staffing issues. And they were saying how this has impacted on care, and patients are phoning up needing care at home. And, you know, they're having to say, I'm sorry, but we don't have that care, and how difficult it is. So, and Tracy, I want to ask you about this. Have you come across or seen that there's been an impact on patients' continence care because of this? And is there an increase in such as pad usage rather than, you know, like the say, you know, toileting systems regimes for residents in care homes, or, you know, patients at home with carers?
When we're assessing patients who have got what we call intractable incontinence, so they've had the assessment, we've checked that there's no red flags, we've gone through the lifestyle and treatable factors, and they do clinically need pads, they are then prescribed pads. But we wouldn't prescribe pads. A clinical need to avoid isn't avoiding toileting. So it is, the pads have got prescribed based on that patient needing them clinically. One of the things that we're finding, because continence isn't talked about, it isn't have that high priority. Some people think it's perfectly normal and expect people to be incontinent purely because they're older. A lot of the care agencies and the care homes haven't had the support and the education around the products as they are now. So we've been doing some work and teaching with our care homes virtually, and I did a teaching with care home that had been struggling with some of the products, and it was the mid-70s the last time the care home manager had some training.
Wow.
And the technology and the products and patients' needs have changed greatly.
Yeah,
since
I know
the mid-70s.
Yeah, I know when we've been chatting before, and I know Claire and you come across this, and we were saying about, and I have patients who are in their beds and they're, you know, kind of laid on pads or there's Kyla sheets, and it's just that a fitting of pads correctly. And you've seen that quite a bit, haven't you, as well, Claire? You're on mute.
Yeah, I think it's really important, but I think as well within nursing homes, residential homes and care agencies, they do have such a fast turnover of staff. So sometimes you find that you and Sarah will agree with me here, you get to a point where you think you've done some education and teaching with all that staff in that home or that care agency or that residential home, and then people leave and go to a different home, or they leave and then you've got to start from scratch again. I think for me, it's about managers, clinical leads of those homes to realise that, you know, continence management is not rocket science. It's fundamentals of care, and it's basic nursing care, and but when done right, it has a massive impact on our patients and their quality of life and their, when I teach, I actually will pass a pad round that's got water in and say, feel how heavy that is. Can you imagine sitting on that all day? how uncomfortable it can be. It's much better for somebody to be toileted, to go on the toilet, and most of the time all our amazing patients will void on a toilet, but it's really important that we really push for those robust toilet plans and really empower people that are working in the social sector and nursing homes to think like that and think that a pad is a last resort.
Yeah, it's a dignity, isn't it? Dignity of care.
100%.
And it's it's not just, like you say, it's not the easy option, even as busy and short-staffed as services are. We have to remember there's an individual at the heart of this, and it could be one of our parents, it could be a family member at the end of the day. Let's be honest. Specialist services, all specialist services are under-resourced, and continence care, absolutely, I know, massively under-resourced. How do we raise this issue locally and nationally? Sarah, I'm going to put you on the spot here. What are your thoughts on this?
I think events like this are a really fabulous starting point. I think one of the things and Claire and Karen and Tracy before, we've changed so much during the pandemic. I can remember going into health centres to see customers, and every health centre had a board up, an information board with this, you're not alone, this is, and all the patient leaflets, and we've lost all of that because patients aren't going in anymore, individuals aren't going in, and I think it's that combination of, we know it's a very sensitive area, but it's highlighting that it's not a Cinderella service. It's not, we keep talking about the basics and that it's it's just the basics, but it's really complicated. What these specialist services are doing, the assessments that they're doing is complicated. It requires a lot of knowledge, and as Claire said, it's life-changing. If you get it right, it's life-changing, and I just think it is just putting it on the agenda. It's having to talk and shout about it, and sometimes make a bit of a nuisance of yourself, but with Claire, Karen and Tracy, they're just three of the wonderful clinicians that are out there, and it's just giving us the opportunity, because continence isn't seen as exciting, but I think to all of us that work in continence, it is. We love it.
No, it's these subjects. I agree. I'm in wound care, and it's like, it's not a sexy subject, is it? Continence, bowels and wounds and things like that. But the national impact, not just on patients, but financially, is enormous. So, and everything has a knock-on effect with each other. Continence, skin integrity, fall. So, it all needs addressing, because one will just relate into the other. And, continence products are generally seen, aren't they? I know in trusts, and they're seen as an expensive accessory to patient care, and having those challenging discussions around budget requirements and things is quite difficult. Ali, how do we combat this?
Well, I think, like Sarah was saying, continence or bladder and bowel services are seen as a Cinderella service. And when you're in your service, you have a budget that you have to work to, but your patient cases, your referrals increase all the time. So I think it's about raising the profile and pushing those boundaries with commissioning, if commissioning is in your location, or finance, procurement. It's just raising the profile around continence. The things around patient journeys, I think, can be so powerful, that you could be providing, after doing an assessment, the right product that could actually enable that person to stay at home and to be independent. So I found in my previous role, having those kinds of conversations with people to understand that patient having that right product could be the right thing for them at that right time. It's patient specific.
Yeah, and there might be people in the audience who have got experience of this and gone down that route. And I know when I've had to do things like this. And and that's the thing, as nurses, we and as specialist nurses, we're expected more and more to be involved in business skills. We're nurses, we're not always trained in that. We don't, so it's probably an area we need a lot of support with. And you're right, that patient experience, patient story is very powerful these days, and that's what, when you're going up through, the levels of leadership within the trust and to finance, it does talk. But it is impactful, and we also need audit and data to increase the resource for business cases as well. So do you think that we need to have more awareness and education in those kind of audit data, business skills, and where do we go within the trust to get to raise that and get what we need? Ali, I'm going to come back to you again if you don't mind with that.
No, that's fine. So it can be really independent, whichever trust you might be working with and who your connections are. But I think this is probably the exciting part of my role as the strategic healthcare partner, because of having that opportunity, because I have that clinical experience, to be helping support with building business cases and helping with patient pathways. Because like you say, within different work environments, you might not have that expertise, that support around to help build those cases, to redefine what good looks like around a bladder and bowel service.
Yeah, it's it's something that maybe we will get more experience and training on, or not, but things that maybe we need to push for. And then thinking about kind of the products themselves, we've got lots of we're not just talking about pads, there's lots of different products there with with the sheaths and all sorts of many different things to assist patients who have incontinence for their quality care outcomes. And Tracy, I'm going to ask you this as a clinician on the ground, and Claire, what if anything, what is the thing that matters to you most from when you're looking at products that you need to for patient care?
It's got to be the right product for that individual patient, but to know that you need the full holistic assessment, and you need to understand what's going on with all aspects of their health, life, mobility, because it might be something as simple as helping a patient find the right type of urinal to give them the independent toileting. And I spent years working as a community nurse under the impression that you couldn't get urinals from the NHS, when actually there are prescribable products which would have been life-changing for one of my patients that I had in the community, where you can get a urinal that actually attaches to a night bag. So a gentleman or a lady can use the urinal in the night, drain it through to the night bag, and the carer change it in the morning with no risk of spillages and no risk of getting out of bed, falling in the night to rush to the toilet.
Yeah, and again, sometimes it's utilising everybody, isn't it? Our industry partners, OTs and physios into things that we just might not be aware of, but they're there. Sometimes they're sitting in stores, or they're available, like you say, on prescription. And Claire, I know you've believe like with such as sheaths, and there'll be other things that it's educating the patients and carers, isn't it, to be able to use the right products.
It's exactly what Tracy said. The thing is, if you don't prescribe the right product, whether that be because the patient hasn't had a proper assessment, the patient then will try it, it will go wrong, and they'll lose trust in it, so they won't use it, and they'll have that bad experience. So you've lost their trust straight away and their focus. So it's about getting the right product, and you don't get the right product straight away. Sometimes you have to look at different products because everyone's different, but it's trying to do that full assessment, and also how is it going to affect their daily their life, because we're not just talking about patients that are retired, we're talking about young adults that are using containment products, sheaths, you know, lots of different things every day, working full time, got young families, so it's got to be right for them, otherwise there's no point. And then that's when you get that actual wastage, and your budget's going up because people are on the wrong products, and you've got that wastage because you can't take them back, you know, especially with COVID at the moment, you know, they can't be returned, those sort of things. So therefore it's really making sure that, you know, you've got a viable sort of service, and that the containment products or whatever you're prescribing are the right for the patient, or you're sending samples first instead of a large delivery. But it's life-changing. It's absolutely life-changing for our patients with the right, you know, there's nothing better than coming into clinic and reviewing a patient and they're back on the coach holidays because they've got a convene on and they haven't got to worry, and they're going to playing bowls, and you just see that zest for life back in their eyes, and there's nothing like it, and that's when you know you've done a good job.
Yeah, absolutely. You know, people live lives, don't they? You know, we're all living longer, and people are active, and you know, because they have particular health issues, it doesn't mean to say that it stops them in their care. And Tracy, have you seen any effects, and I'm saying this with my tissue viability hat on, sorry, but have you seen any impacts on MAS, you know, moisture associated skin damage and incontinence associated skin damage through COVID, particularly because of, you know, these changes that we talked about, and you know, less toileting, and you know, have you seen those issues, and have you had to liaise more with, you know, different services?
There has definitely been an issue, but it is something that I had a problem with beforehand, and the majority of patients that I see coming into clinic have been using a disposable pant known as a pull-up, or the bed sheets, or both, which are products that aren't designed to be used long-term for incontinence. The pull-ups there to help people who are continent but have dexterity and mobility issues that are losing small amounts of urine. When somebody uses a large amount, it leaks out the side, and they move and they rub. Yeah. And it's the same with the bedsheet type products. That urine is running down that patient's body before it hits the bedsheet.
Yeah, and it's sorry, go on. Sorry, Tracy.
It's causing the skin problems, but I think because more people are approaching services because they haven't been able to get products that they've been buying themselves normally, we're seeing more, but it's not a new problem. And the percentage of letters that I'm writing about products and skincare and patients going to the GP because they've got sore groins and incontinence associated skin problems have often had a course of antifungals, because on the telephone consultation it's come across that they might have a fungal infection, and those products, the same as oil-based barrier creams, when they're used with the pads, then block the pads, stop the pads working, and we're in a vicious circle then, getting more leakage.
Yeah, the good old zinc-based thick creams that we won't mention the name of.
And I think those are all the types of things we get questions to the helpline on. You know, people will ring up about products not working and the practicals, and again, you know, hopefully we can help sort of navigate through those, you know, initial things. But again, a lot of it is sometimes they do need to see the health professional. It might be that it's a reassessment or a brand new assessment, but there are a lot of the types of calls that we get where people are just sort of, I think, overwhelmed sometimes by what's on the supermarket shelves, and where do I start, you know, what do I buy kind of thing, you know. So again, it's sort of taking that back step and saying, well, actually, have you been assessed, and you know, what do we do about actually treating and trying to improve, you know, symptoms for you.
Yeah, absolutely. Thanks for that. That's brilliant. And I just want to ask Ali about you know, for clinicians generally, clinicians who are specialist clinicians in this area, but general clinicians who are dealing with who are coming across patients who have you know, incontinence issues. how would they be better supported in their role? And, you know, is there enough training generally in healthcare and the social care sector for this? I know we briefly mentioned about the ECHO project, which was kind of a brief project that, you know, Tracy and I were involved with, but, you know, it was in pockets in certain areas. So what type of training is there for wider access for people to, you know, and what's the best way? Is it digital, virtual? The face-to-face is much more difficult now, but have you got, sorry, I know there's lots of questions within there, but
yeah, I think for obviously with my RCN hat on, I'm going to say there's obviously our online resources that is available, but I think Sarah may be the best person to answer this one around Essity offering. But there is also, there is. Can I hand it over? Sorry, can I hand it over to Sarah?
Absolutely, yeah. Sarah, if you're happy with that.
Yeah, absolutely. Because I mean, education. Obviously, working as one of the clinicians, previously and as advisor now clinical consultant for Essity, education is something that we've been sort of trying to adapt and improve and get out there for years and years. And it is, I know, like Claire mentioned previously, you know, sometimes it does feel like it's hard work, and I think it's a combination of perhaps you know, it's not mandatory. Nobody has to learn about bladder and bowels. Nobody has to learn about, you know, those kind of things. And so sometimes engaging people can be difficult. And it's the workloads, particularly during COVID. We've found that a lot of the care homes, when they most need the education and they most would benefit from the support, is the exact time when they just can't spare the staff to go through the training. But you know, we've adapted as far as we can. We've adapted everything to be virtual. I think we've all become a lot more comfortable. NHS companies, everybody, and the whole country, I think, has become a lot more comfortable with doing things virtually, which means we can get to see more people. It's also just as sort of the NHS have had a chance to relook at how they perhaps did assessments with the telephone calls and that kind of thing. We've had a chance to look and say, what are we offering that is virtual, that is accessible? So we've had a chance to improve our e-learning offering. We've also taken the opportunity to do lots of little bite-sized training videos, and working really closely with the clinicians. I hesitated because I was going to say with our colleagues in the NHS. I suppose strictly speaking they're not, but it always feels like they are when we're working together, and being able to say, you know, what do you need? What can we do to help you? Because we're really fortunate in Essity that there is that support for people to stay registered, to stay up to date, to go through all the continence courses, the teaching courses, so that we can be that extra mouthpiece really to get the education out there to people. Because it's the, you know, we've done a lot of work in Essity about education, and we've said getting continence right changes lives, but education, it's everything, isn't it? You know, there's nothing better. It opens doors, changes lives, and you know, it's something that we keep pushing, trying different ways to get the message out there, really.
Yeah, and you mentioned in there like the bite size, and one thing that I've found is, you know, and again it's that time constraints. A lot of the training was stopped in areas, you know, and we were literally, you were like, you know, trying to you just get, you know, bite-sized things in, and you know, any education is good education. And then there's that whole self-care, isn't there, as well, to patients, carers, not just clinicians as well. Yeah, and
I think some of the charities have got very credible education as well. You know, ourselves and some of the other charities, they run, you know, very good sort of sessions, and that's one of the things we've had to sort of really step up the challenge to, is online sort of teaching rather than that face-to-face teaching. And I think that's something that we will all probably learn to develop, you know, going forward. But again, it then makes it maybe a wee bit more, you know, accessible. And I think, as you're saying, there's been sort of the webinars and the onlines have been very helpful for the general public as well, because there's been lots of those types of education events put on for general public as well from a bladder and bowel point of view. So again, it's casting that net across not just the health and social care professionals, but, you know, parents, general public and the like, really.
Yeah, and back to that, you know, NHS long-term plan is, you know, health coaching and people to be autonomous and accountable for their own care, you know, all comes within that umbrella. So it's really important. We've discussed, well, I mentioned at the start about, you know, the forum, and I bet a lot of people, I think, are really, you know, they're wanting to hear about this forum, which, you know, I know from, you know, you've told me about it, that, you know, this amazing platform that's connected people in the bladder and bowel professional sector in the north of England, and we want to enable people across the whole of the UK to be able to also be involved in this. So Sarah, you've got, you know, I haven't got the information, you've got it, so I'm going to give you the platform now to just tell everybody about how it started, how it works, and everything else within that. So.
Thank you. So it did, I think you mentioned in your introduction, Alison, that it came from a conversation between one of our customers and one of our contract managers, Joe Mitchell, and I think it was probably a conversation that had been had with Christine, the customer, on many times, many occasions, and it's logistically, perhaps it always seemed a little bit difficult. It was a bit of a pipe dream, I suppose. How can we all get together? We've done these things in the past, and we know that, you know, with NHS clinicians, you know, getting time away, travelling, it all impacts on their workload and their caseload, and actually it would have been very easy to just leave it at that and let it drop. But Jo is so passionate, as we all are, you know, everybody here is so passionate about it that she wouldn't let it drop. And we got together, we had a meeting as a local team in the north. We had a meeting, we talked about the idea, and it just kind of grew. You could feel the enthusiasm growing within the sort of our team at Essity. We really wanted to do it. We wanted to do it virtually, but we didn't know whether, again, the people, because we've been struggling, perhaps connected with care homes and things, people in the NHS, are they going to have the time? Are they going to get the benefit from it? And is it going to be useful to them, because their time is so precious? So it started, as I say, to the determination of customers and our account contract managers in wanting to get people together to get talking. And then once we kind of sent out the invites, we got like a basic agenda together. We'd seen some research that Alzheimer's Society had done, sort of really looking at carers and the care experience of people out there, knowing that people were struggling, that, you know, we knew that it was really difficult. I think one of the benefits I have as a clinical consultant across the whole region, I can see that people are having the same issues and the same conversations, and I'm privy to some meetings, and, you know, I get to learn so much in those meetings. And you know that, you know, with hindsight, you think, gosh, if everybody could hear all those conversations, they would feel so much more empowered, and they'd feel like they're not alone, and it just gets that enthusiasm level up. And so that's what we wanted to do with the forum. We wanted to keep it quite small in numbers, because we wanted everybody to have the chance to contribute. We've done 4 of them now. We started off, we set the agenda, although it was very much about us asking questions of the people, of the clinicians that were there. And I think the 2 things that sort of struck me from doing this was just how open people will be, and how much people will share, and how much people want to help. We never had a forum where, you know, everybody was sort of saying, oh, can we swap email addresses? Oh, I'll send you that, I'll send you this. And it was just lovely to sit back and see that networking going on, and knowing that they felt comfortable to do it in, you know, within something that I suppose a supplier essentially had provided, and feeling really privileged that clinicians trust us in that way, and also trusted us with their time, because we know how precious their time is. When we wanted to develop it a little bit more, we again our amazing clinicians, we kind of approached them and handed it over to them a little bit. So we looked at doing something really specifically for paediatrics, because we knew that was something that our customers were asking for particularly, and also we acknowledged that perhaps the clinicians within Essity, within the regional team, perhaps weren't all paediatric trained. We didn't have the specialism, and so we approached our customers I'd heard conversations of you know, in meetings where customers have said, is it like that? Is it like that everywhere? You know, what do the other accounts do? What do the people you work with say? And so we just kind of said to them, well, this is your chance. You share what you know. And again, we had some wonderful clinicians. We had Lynn Wilkinson, we had Rachel Ward from Bradford doing, you know, and it was just lovely for everybody to be kind of in a really nice environment. It felt very intimate, even though it was virtual. And it just got to the point where people were sort of saying, can we do this again? Can you cover this next time? Can you do that next time? And it just made us realise that because we'd kept it small, it was great, but we wanted to invite so many more people, and we just wanted to kind of get this setting, get this emotion. And we're more than happy. We appreciate, as I said before, we know how valuable the time for these clinicians are, how busy they are. And we've got the time, Essity, of letting us, you know, have the time to kind of to take that organisation, to do the organisation, so that really all people have to do is give us a couple of hours and turn up, and we'll do all the other bits and pieces. But obviously Claire and Tracy were at one of the events, and I hope they found it. Well, I know that Claire and I know Tracy, because some of the comments we had back, people was, you know, saying, oh, we knew it would be useful, but we knew it'd be good, but we didn't think it'd be this good and this useful. And yeah, so I think I've probably gone on a little bit, but they just have been wonderful. I've enjoyed doing every single one of them, and we really want to roll some more out. So if there are people who think, oh, that sounds like a good idea, you know, just get in touch. We'd love to expand it as much as we can.
Oh God, that your passion for that, Sarah, just really came across. I can, you know, and Claire and Tracy, the smiles on your faces were. Obviously, it sounds absolutely amazing, and this is the sort of thing, isn't it? It's born from that simple, you know, conversation and idea, and it needs to spread. This is how this is what makes change, definitely. And there are questions that are coming in, and some of the questions are, you know, related to this. And so there's and so I'm going to go into questions now, because, you know, there'll be people are wanting to know all about this. And other things. So question for Tracy, this is a question to you about how did you, and so the question is from Claire, how did you adapt your assessment approach over the telephone to get the right products to the patients?
What we've done is well, we carried on doing the assessment in the same sort of way. We've gone through all the holistic points, everything around the patient's mobility, their needs and their ability. But what we have kept as well is trying to get accurate sizes and measurements for the patient as well. Because once you know somebody is incontinence is unfortunately untractable and they fall into that 30% of patients that we can't fix, then we need to work out what's right for that person, and we need to understand their mobility, because what we don't want to do is give them something that's going to make mobilizing more difficult, make them more likely to fall. We need to understand what's going on with their fluids, so we're getting enough absorbency. We need to know if they're able to toilet at all. We need to know what sort of positioning they're in. And it's just been having to unpick everything that we would do face to face, but through the telephone.
Yeah, it's having a good assessment framework, isn't it? At the end of the day, you know, if you've got a framework that covers all that holistic care, whether you're doing that face to face, virtually, or on the telephone, you are still gleaning. And you have, you know, we often have electronic patient records in the community. We have more access to that than obviously in acute. But you know, you can glean a lot of information in this way.
And we do use a pre-assessment questionnaire to try and pull out some of that information as a starting point, so we're not having that conversation with the patient or their carer totally blind.
Yeah, absolutely. Yeah. And we've got a question just come in for Ali W, not me. So how does your role specifically impact on patient outcomes?
Okay, so I think for my role as being the strategic person is helping to look at a patient journey. So I will be looking at, you know, could a particular product make a difference around, like Tracy is saying, around their independent toileting, and helping people understand that the cost of a product at the source, so for a service, might be quite a lot, but actually it might prevent a fall. So it's kind of evidencing that. And I think, like Alison had said earlier about, you know, the understanding the oh, I'm really sorry, Alison, I've forgotten what I was saying, sorry.
Yeah, it's about, isn't it? And I get this. It's about quality of products and things, and you know, the cheapest isn't always the best, is it? And it's when you measure, you know, and that's when we, you know, we're measuring those outcomes, aren't we? So we're saying, well, we've got this product. It's an effective, quality product. So, you know, and you can use that, you know, for longer or whatever, it's more effective. So we're not then getting moisture-associated skin damage. We're not getting falls, and we're not getting all those impacts within. I think that's maybe what you were trying to get
thanks.
to. Yeah.
Thank you, Alison. Sorry.
Yeah, absolutely. You know, it's absolutely so important within all supplies of things that, you know, we get into the NHS for sure. And now, Sarah, we have a question for you from Debbie, and she's saying, do you think the training of care home staff, we know we've got care home staff audience with us tonight, do you think that training for them, for those staff, is completely the responsibility of the care home manager? And how receptive are they for the availability of training? I think, Tracy, you wanted to comment on this as well. I'll go to Sarah quickly, then I'll come to Tracy on this.
I will be brief, I promise, Tracy. I do think as a care home manager, particularly thinking that perhaps of a nursing home, if that care home manager is a registered nurse and has to, you know, they have to abide by the code of practice, and so I do think they are accountable, and I do think they are responsible for it. They should want the best for their patients. So yes, I do think it should be the nursing home manager, and the homes that we go into where you've got good management, you get good staff, you get good care, you get good training. And the only other thing I would say is that I think sometimes I don't think the public always quite realise what a hard job these care homes are doing, the staff are doing, the hours that they work, the shifts they work, and the conditions that they work in. And I think as much as I'd like to raise the profile of Bladder and Bowel and things, I think care, the whole way sometimes we look at and we treat care in this country, and care staff, it needs looking at, it needs improving. And I think if we could raise that so that it's a more attractive proposition for people to want to be involved in care and come into care and to be healthcare support workers, then they will naturally we'll get the right sort of people that naturally want to take responsibility for their own learning.
Yeah, absolutely.
Sorry,
And Tracy, jump in.
Yeah, well, what I really wanted to do was brag, because we're really lucky that we've got a really good care association in our area. So we've been doing some joint working with them and using devices that the CCG have put into our residential homes to try and make the training more accessible and available to our care homes. And we're looking at trying to get it recorded to have it accessible anytime. But
Brilliant. Yeah.
As specialist nurses, we wouldn't have achieved that without the joint working with the care association.
And that's what good looks like, isn't it? And that's the stuff we need to capture and we need to share. And obviously via forums, then, you know, you've got the platform to do that. Claire, what does a good training programme look like?
A good training programme's got to be interesting, and it's got to be appropriate for the people that you're training, and it's not got to be boring, and I think it needs to be realistic, and really capture what those people who are coming to the course are dealing with. and also within that training trying to find solutions for them, but also trying to signpost them to Bladder and Bowel UK, to Essity, to the online forums, to really empower them to look into different ways of working and delivering evidence-based care for their patients, and also to utilise us and to get to know us as specialist nurses as well, so they feel comfortable to give us a call if they were worried about a patient, or you know, or ask us, oh, what do you think of this, and you know, us really celebrate that the fact that they've actually contacted us and are learning with us, you know, and it's about leadership, isn't it? So it's just nurturing those sort of people that want to learn and really are focused on making that change to their patient care.
Yeah.
And I think going back to the previous question, you know, we're talking a lot about nursing homes, residential homes, and I think whoever is in charge has a duty of care to those patients, and I think one of my staff's idea that she's had for recently for the last year and a half is us as a continence service, bladder and bowel services, whatever you wish to call our amazing teams that we've got, is perhaps we need to look at like a 4-star sort of scoring system for nursing homes, and if they attend continence training and they don't have a lot of pressure sores and they really are showing that they're really invested in continence care, then have a you know, a sort of star sort of scoring system so relatives can see that. So when relatives are looking into nursing homes for their loved ones, they know that they've got a 4 or 5-star rating on continence, because I want my mum to go in that one, not one that's got 1 or 2.
Absolutely, Claire. That is such a good answer. Thank you. Brilliant. And I'm going to ask this, I'm conscious of time, so I'm going to throw this question to the panel and I want one of you to answer. Is there a national standard for continence training for caregivers? If not, why not? Who's going to answer? Who's going to put their hand up first? Karen, I'm lucky you're smiling.
I think Ali's going to answer this one.
Yeah. Let's do it. Let's drive it.
Let's drive it. So there isn't one, we're saying. No. I'm sure there isn't, but we need one and we need to drive it. So we've said it tonight here. So let's, you know, that's something that we definitely need to do. Okay, so brilliant. So that's comes to I'm sure we've got more questions, but we will get to them another point in the next couple of days. So I just want to, before we you know, I'm going to share with you an amazing video about some education that you can get involved in. So, but just first of all, I want to thank all our amazing speakers tonight. It's been fantastic to listen to all this great care and things that are going on in the forum that you must all, you know, get involved with if you're involved in continence care. And, you know, to all of you in our audience for spending your evening, your precious evening with us. Thank you to Essity for sponsoring this session, and to Urology and Continence Care Today for providing us, as always, with such an amazing platform for discussion and great education. Your certificates are available on screen or in the comments for you to download for your CPD. Please do like our page and you will get notifications of up and coming events. Do not miss out, because we've got some amazing stuff coming up. And I'm going to give you your call to action, which from Essity, we have a great new education professional accredited training for healthcare professionals path. So now please take your path, watch this video and see what's coming for you. So have a great evening, everybody. Once again, thank you so much for watching, and we will see you all again very soon.